Good morning, everybody, and thank you so much to Global Health Network for having me here today. Almost 1 year into the devastating war in Gaza, we remain standing at a precipice. Sorry, I'm low. There we go, okay. Sorry. The industrial-scale destruction of civilian infrastructure, compounded by a suffocating siege, has pushed the civilian population to the brink. Through its humanitarian and medical response, MSF has witnessed firsthand the human cost wrought by the destruction of Gaza's healthcare system. More than 1.8 million internally displaced Gazans are living under the threat of starvation, disease outbreaks, and psychological trauma. Thank you. As this catastrophe persists, the collective capacity of aid organizations to launch the full-scale response required to save lives continues to be severely constrained by the ongoing insecurity and by the restrictions imposed on the entry of humanitarian aid into Gaza. Before October the 7th, 2023, MSF teams had worked in Gaza for 35 years. Israel's 15-year blockade on Gaza had already significantly weakened the healthcare system. On the 13th of October 2023, MSF medical teams, alongside the civilian population, were forced to evacuate from North to South Gaza under the threat of bombardment by Israeli forces. To respond to the urgent healthcare needs of the newly displaced population, we swiftly set up emergency medical activities in Rafah and in Deir al-Balah. This included activities in 2 primary healthcare centres, a postpartum ward attached to Emirati Maternity Hospital in Rafah, and throughout the war we have also provided trauma and emergency surgery for war wounded at various hospitals in northern, central and southern Gaza. However, the devastation wreaked by this conflict extends far beyond those killed by Israeli bombardments and airstrikes. Equally tragic are the silent killings, the individuals who have died because of entirely preventable circumstances or from their critical health care being disrupted due to the conflict. Even in the event of a ceasefire in Gaza, thousands of such deaths are likely to take place due to the time it would take to improve water, sanitation, and shelter conditions, reduce acute malnutrition, and get the healthcare system back on its feet. This crisis is entirely man-made. What is being witnessed is a situation of deliberate deprivation. During May this year, across just 2 of the primary health centres run by MSF, teams were providing an average of 5,200 outpatient consultations every week. 40% of these consultations were for children under 15 and infants. As well as general medical consultations, our teams in the clinics provided paediatric care, wound dressings, and minor surgery. MSF teams have been screening people for acute malnutrition in the clinics as well, particularly those in the highest risk categories, children under 5, pregnant women, and new mothers. We have seen acute malnutrition emerging at an alarming rate, especially given that it was previously absent in Gaza. We didn't actually detect any cases of acute malnutrition in Rafah before mid-January 2024, when cases of moderate and severe acute malnutrition really started to be registered on a weekly basis. By the end of March 2024, 216 cases of moderate and severe acute malnutrition in children under 5 had been registered in RAFA, with 27 cases among pregnant women and 25 cases in new mothers. These figures, however, represented only a small part of the larger reality, as they're based on only the screening of patients who came to the MSF healthcare centres. Of course, in May, we also had to evacuate these clinics in Rafah and move again back towards central Gaza, as the humanitarian space to treat people was diminished even further. To date, our teams have been forced to evacuate healthcare facilities and hospitals 14 times across the Gaza Strip. After more than 11 months of exposure to potentially traumatic events and extreme loss, people across Gaza have staggering mental health needs. It's not really yet possible to talk about post-traumatic stress disorder, as the extreme levels of violence are still ongoing. People are packed into densely populated areas, living under the threat of a full-scale incursion by military forces, and they have no sense of safety. MSF teams are providing mental health care and psychosocial support now in Deir al-Balah and Han Yunis, including psychological first aid, individual consultations, and group and family sessions. Most patients have symptoms related to anxiety and stress, including psychosomatic and depressive conditions. With the ongoing extreme levels of violence and insecurity in Gaza, it is really challenging for our teams to help these patients build resilience at present. The impact on children is, of course, particularly pronounced. Last November, MSF staff in Han Yunis met a 9-year-old girl named Noor, who had survived a bombing attack and was being looked after by a distant uncle. She did not yet know that her entire family had been killed in the bombing. And sadly, this is the situation for many thousands of children in Gaza today. Currently, we provide group mental health sessions for children in 3 of our primary healthcare centres due to the critical need for specialised support. People's access to safe drinking water across Gaza is also severely limited. A functional water infrastructure and distribution system relies heavily on fuel. Without fuel, it's impossible to pump water from the underground aquifers, which were previously the source of 80% of Gaza's safe, clean water. We still distribute approximately 600,000 litres of water per day to more than 40 water points in Al-Mawasi, Han Yunis, and Deir al-Balah. However, without the fuel for transportation, water distribution is inevitably limited, and it results in people receiving far below the survival level of 20 litres per person per day. The direct impact of such poor living conditions on people's health is evident. In our clinics, upper respiratory tract infections remain the most common, seen in more than 40% of patients. Diarrheal and skin diseases associated with poor sanitation and hygiene are also common. In the last 3 months of 2023, cases of diarrheal illnesses reported among children under 5 were 25 times higher than during the same period in 2022. More recently, MSF teams have seen cases of acute flaccid paralysis. We're not actually able to definitively diagnose it as poliomyelitis, but 2 cases confirmed by Gaza Ministry of Health did accelerate WHO's recent polio vaccination campaign. Families who have endured these multiple displacements while fleeing the bombings are now at risk of death by disease. An average of 180 women give birth in Gaza every day. While we were in Rafah at the Emirati hospital, our staff were dealing with almost 100 deliveries per day. However, due to the evacuation in Rafah town, we had to re-establish maternity and neonatal services in Nasser Hospital in Han Yunis. Nasser had also been previously evacuated. It was one of the 14 evacuations that we've done round about the Strip. However, it was only partially destroyed, and it was possible that some areas in the hospital could be made functional again, and this is now the only maternity unit in Gaza. In the primary healthcare centres, we see 200 to 300 women weekly for gynecological and obstetric consultations. The most common conditions there are genital urinary infections, anemia, and gynecological hemorrhage. An MSF gynecologist observed during consultations that most of these conditions would normally have been detected earlier during the regular monitoring of pregnancy. Although MSF is providing postnatal care in its primary healthcare centres, it's next to impossible to support mothers and follow up on their and their baby's health in the weeks following the birth. In Gaza, we have estimated there are something like more than 350,000 people living with chronic disease. These patients constitute approximately 5 to 10% of the consultations that we see in the primary healthcare centres, and they include people suffering from arterial hypertension, diabetes, asthma, epilepsy, but also cancer patients requiring specialised oncology examinations. Prior to the conflict, these patients' conditions would have been monitored through the primary healthcare system, but now they often need to be referred to secondary facilities with no guarantee that the treatment will actually be available. Last month, we were compelled to open 2 new mobile field hospitals in central Gaza without sufficient supplies and equipment. It took us over 6 months to obtain the required permissions to get these hospitals into the Strip, but unfortunately, most of the supplies for them remain obstructed. For MSF, opening field hospitals is a last resort and can never replace a functioning hospital and healthcare system. Finally, I would like to close with an image of our burns clinic close to Shifa Hospital in Gaza City. The clinic came under fire from heavy military vehicles last November and suffered further destruction during the weeks that Shifa Hospital was under siege. Because this is really the story of a healthcare system that has been systematically destroyed during 11 months of war. Even though hospitals, clinics, medical staff, patients, and civilians should be protected under international humanitarian law. We are not politicians, we are medics. We can't put an end to the wars or tackle the underlying causes of human suffering. Our work is often unable to meet all the needs with which we are confronted on a daily basis. But for humanity to prevail, policymakers and the international community must understand the human cost of destroying an entire healthcare system. Yesterday, it was reported in the news that more than 110 people had been killed in Gaza since yesterday morning. But what we wonder is how many more silent killings have also occurred during that time. Thank you.